Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what do outpatient medical coders do. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Alright, what is an outpatient? An outpatient is a person who goes and visits their doctor and goes home in the same day. This person is not staying in a hospital. That is called inpatient, right? And when you have inpatient, it's going to be under different rules. They even use a different procedure book. But for the purposes of today, I'm going to be talking about the outpatient setting and what do outpatient medical coders do. Obviously, both inpatient or outpatient, it doesn't matter. We use the ICD-10 CM book. That is our diagnosis book. But for the outpatient setting, we use the CPT manual, which is the current procedural terminology manual. This book houses both the evaluation and management codes, and it also houses the outpatient procedure codes. Okay, so it's all in this one book. And then we also use the HCPCS book, HCPCS Level 2 book, and inpatient uses this as well. But this houses all of your durable medical equipment and bandages and medications and things like that. So all of those codes are in that particular book. But yes, when you are in the outpatient setting, you will be using the CPT manual. Now, the types of clinics and settings that we work in. So when you're working at a hospital and you are a medical coder in a hospital that's working in the outpatient side, typically you're working with the specialty clinics, or you're working with family practice and things like that. Sometimes you can be working in the ER. Outpatient coders also work in urgent care places, optometrist's office, dentist's office, and things like that. So that's where we work, and those are the types of settings that use that CPT manual. So some of the things that we also do is we work obviously together with our providers to make sure that they are documenting like they should, or if you're not doing that, hopefully somebody in your facility does it, or if you need to start doing it, hopefully you will start to do it. If you are brand new to the field and you are wondering like what outpatient clinic would be easy for me to kind of ease my way into and start, there is no easy clinic. There might be redundant clinics, but the best thing for new coders to do is to jump in with both feet. If you are starting somewhere new, they already know that you're new. And the only thing you have to do is be willing to take that challenge and grab it with both hands and run. Because of the simple fact that that is the best way to learn, especially in the beginning. Because if you hold back and you worry and you overthink about like, oh, how can I do this? How can I do this? We were all there as brand new medical coders. Believe me, we were all there. And the more exposure you get to different clinics and different specialties, the better off you'll be, because this will get you used to just the different things and just being able to take a lot of that chaos that can sometimes happen as medical coders that we all go through. You'll be prepared for it because you let yourself and you allow yourself to have those experiences. So when you are working in an outpatient setting, obviously there's a huge variety of clinics and specialties that you can work in. Now, I recommend that if you're being assigned to a particular clinic, that you actually take the time to learn all about that specialty. So if you're working in the cardio clinic, take the time to learn about the heart and the vascular system and all of that. That is what you want to do to set yourself up for success when it comes to coding in that particular clinic. Now, different places are going to have different rules, but some of the things that we do, for some places, they have just a group of coders who are working from a queue. So they'll have all of the encounters maybe broken down by specialty and clinic, and then everybody just goes in and just knocks them out one by one by one. Or they might assign you to an entire clinic by yourself, and you will have maybe a few providers or up to 20, 25 providers. It just depends. The bigger the facility, the bigger the clinics. So a lot of times there will be the work split different ways, all right? But if you are by yourself working in the clinic and you're trying to get a hold of like, how do I handle this? How do I do this? you really have to just sort of grab it and, again, run. Because there is no right way. The only right way to do things is to actually get in the thick of it, feel your way around, and try to learn what you can so that coding it will be easier, then you'll be faster. Okay? But that is what we do. So either you'll be working from a queue, or you'll be working in a clinic, and you'll have all of your encounters, and you have these systems that you work in. Most of us work with electronic health records, right? I think every place in the world has an electronic health record. And there's different systems for this. One of the biggest ones is Epic. And there are some tutorial videos on YouTube about Epic. So if you want to kind of look, and sort of get a feel of it, there's plenty of examples, online on YouTube. So that's what's so great about YouTube, is they have plenty of those. But a lot of times you will get training on that when you start in a job. As a medical coder, a lot of times they'll say that if you have experience like with Epic, is a plus, but it's not necessary, because normally they will go ahead and train you when you do start on that particular electronic health record system that they use. So a lot of times when you are working, they're not going to want to train you on coding, on the coding aspect, because they feel that as soon as you have your credential, you should know how to code. That is why it's so hard for new medical coders, because they want you to have experience, but how are you supposed to get experience if no one will hire you? This is why you have to be persistent, and you have to just get into it, and you have to just keep trying until you finally get your job. Now, I'm on LinkedIn, and I see a lot of people on LinkedIn, and I've seen a lot of them go in there and they're brand new, and of course they're upset, they're looking for jobs. But then I see these same people finally find jobs. And sometimes it doesn't happen right away, and sometimes it's a few months before they get their first job, but they finally get their first job. And, I'm always so happy for them, because I'm glad that they stick with it. Sticking with it in the beginning is very difficult. But getting back to, what I'm saying, you have to stick with what you're doing. You have to stick with trying to get in, no matter what you do. That's my little side note, because you guys know I can't always stay focused on topic. Anyway, getting back to being what we do in the outpatient setting. We work with the electronic health records. We work with encoders sometimes. Some places actually do not have encoders, and they expect their coders to work with a book, with the books, the diagnosis book and the procedures book. So, if you're working in a small doctor's office, that is always a possibility. And a lot of times they'll say, well, we don't see a huge volume of patients, so the coder should be able to handle, working from the book. I mean, that's what we did before encoders were out. Obviously, I got into the field when there was encoders. So, although with my first position, we didn't use encoders. We used the books, which is fine. Once you, especially after you've gotten right out of school, it's easier because that's all you're used to. But when you get used to working with the encoder, you have to be careful, because you can get really reliant on it. So just always keep track of your skill and your speed when you are working with the book. That's just my advice anyway. And another thing that we do as outpatient coders is we work with our providers. We work with them to make sure that the documentation is perfect, like it should be, and that it has all the detail in it that it needs. So that way we can make sure that all of the credit that is due to be given is being given, and the provider, the patient, is not being overcharged for the services that they are receiving. So, or undercharged, as sometimes is the case. It just depends. So you want to make sure that you are really actively engaged. If you don't have somebody at your facility, and it's on you to actively engage with the provider to make sure that everything is there. A lot of times you'll see in these job listings, okay, that it says that the coder must be able to work with the provider. I'm going to have to do an episode totally on provider communication. You heard it here first, okay? I'm going to have to do that because of the simple fact, and I've done it before, but I haven't done it in a while, so it's a good idea to bring it up again. When it comes to working with providers, Think about this. These are some of the most intelligent people you will ever meet in your whole life. They are different. They are different in a good way, and they are quirky, and their communication style is unique. Sometimes you will get very engaged providers who I love. I love engaged providers. There is nothing better than a provider that is just as excited as me to talk about medical coding. I think that is the best thing in the world. Then you will get some providers who are, for lack of a better word, arrogant. And they know they're arrogant. And they will not want to listen to you because they don't know you. And how dare you? Who are you? You know, I have a degree and I have my doctor and I'm this and I'm that. How dare you, just a certified coder telling me what to do? It's not that you're telling them what to do. You guys are a team. And that's what you have to kind of work in towards. You have to give it that finesse, and you've got to be able to say, we're a team. And that is what I have done with my boys that I work with. I call them my boys. Of course, I would never say that to their face. But they are my providers, and I do take care of them. And they know that I take care of them because I tell them, guys, we're a team. And you may not like what I say, and I may not be the most popular person in your eyes, especially when I have to come to you and work with you and tell you that you did something wrong or tell you that this is not adequate documentation. They're not going to like you in the beginning, and they're not supposed to like you in the beginning. But at the same time, if you stick with it and you don't let them run you off because they're going to bark at you, they're going to get mad, and they're going to yell at you, they're going to say things that are hurtful. But you have to build that iron wall and be like, knowing that this is going to be a natural reaction because they don't want to be told that they're wrong, you know, or they don't want to be told that, you know, why are you questioning me? They don't want to be told this. But when you establish a relationship with them, and you do that first, that's going to be first out of the gate, guys. You know, when you are working with providers and you're trying to send them queries, I've seen coders who come in hot. I mean, they really do. They come in hot and they don't introduce themselves. They just start sending queries one right after another, and they don't write very good. I mean, like their sentence structure is not very good. The tone of their email is quite not where it should be, because you don't want it to be like, oh, you're being a you know, really just somebody that's very, I can't say it because I'm like trying to keep from using another phrase. Let's see, what can I say? Something that, you know, you don't want to be like you are flattering them too much, right? And you don't want to come off as a hard person either, like really rude. But you want to come off right in the middle. You want to be like, hey, this is, you know, we got to work together here. This is why I always say you have to establish your relationship first before you start doing that. Because if you start sending emails right away and you're just telling them what to do and things like that, of course they're going to shut down. And I've seen providers do that. And providers that are good providers and that are willing to accept guidance and willing to accept help. But when you send somebody in there who has not introduced themselves and just comes in and just basically they feel insulted by, it's going to shut them down and it's going to give them a bad flavor to other medical coders. So I always look at it like this. How I represent myself as a coder is a representation of all coders, because my providers should expect a coder like me who is engaged, who is hands-on. And it's true, because if you're not hands-on and you're supposed to be, if nobody at your facility is doing it and you're supposed to be doing it, that's what you should do. Well, I don't want to talk to them. And I've heard coders say that before too. I don't want to talk to them. I don't talk to providers. Well, what gives you that right? You have to. That is part of the deal. Working with providers, it doesn't matter how shy you are. It doesn't matter how unpolished you are right now. You need to find ways of getting yourself polished up, as far as like polish when it comes to speaking clearly and speaking to the point, being very polite and professional. When you're writing, it needs to be in proper English. There needs to be no grammatical errors. Okay, I've seen too many grammatical errors. I'm like, how can you make a grammatical error when there are so many word programs out there to catch these grammatical errors? There's no reason for it. It's careless and it's sloppy. And you can't do that, especially when you're communicating with somebody who has degrees, right? Because oftentimes these guys have been in school. Guys meaning ladies too, okay? And that's what I say, guys. When I say guys, I refer to ladies and men. But they have degrees and they've been in school for years. And that deserves some respect. Just like you deserve respect, they deserve respect. So as long as you have that going in between, you'll be okay. But at the same time, like I said, there's no reason. And even if you're shy, I was shy too. And believe it or not, I am a very shy person. In my everyday life, I am shy. I laugh at myself because there are times when, yes, when it comes to coding, oh, that's when I turn on the show, because I love talking about coding. You get me talking about coding, you get me talking about injuries, oh, it's on, and I can keep going. And I can be very entertaining when it comes to this too. However, when I'm meeting new people, it depends, because I am the type of person that I will read people and their energy, which is another skill that you do need. Even outpatient coding, inpatient coding, you need the skill of being able to read people, because that's going to help you to be able to tailor your approach to different providers. If you are communicating with somebody and you see from their body language that they are not either engaged or interested in what you have to say, or maybe they're feeling defensive, you're able to tailor that approach by changing it up. And knowing how to read body language is going to be a good indicator for you. It's going to help you. So that's a skill you got to have working in the outpatient setting. But when you're doing that and you're communicating with them, it's going to help, and it's going to make all the difference, because you went above and beyond trying to figure how can you better communicate with these people. Providers are very unique and very special, and communicating with them and in a good way is going to go a long way for you, for your productivity, because as you get better with communication with them and they get better with their documentation, the faster you'll be able to go through all different kinds of encounters. Because in the outpatient setting, the production is averages. I've seen some production as low as 80 per day versus up to 150 per day. I've seen some that were at 150 per day. So that is just the range, and that's the average. The higher the number is, usually the more redundant that particular clinic is. Like if you have like an immunizations type of clinic, those are usually clinics in the outpatient setting that have a higher number of expected volume that you're supposed to get done coding in a day. So that is the difference there. Usually the lower the number, the more specialized the clinic, the more specialty the clinic. So it really all depends. And that is a quirk of the outpatient setting, is that we have, it looks like it's high because on the inpatient side, it's a little bit lower, like a few per hour, but only because you're going through entire records when it comes to the inpatient side. Outpatient, we are just seeing what happened to that patient on that day. So if it's not documented on that encounter, it did not happen. And that is why I say you have to have full and complete documentation all the time when you're looking at these outpatient records. And because again, that encounter is what we're dealing with on that day. So that is something to keep in mind. But working with them is key. That is going to help you, because the more streamlined you can help them get their documentation, the better off you will be when it comes to getting through encounters quickly. I've learned this by working with my boys. I mean, seeing how they started versus how they are now, it is a night and day difference. Their numbers and everything that they do is a night and day difference as well, since I've had them. So when you care about what you do, that's all the difference as well. So There's those things. See, I talked about the production. Accuracy rates on the outpatient side range again. I've seen some that the average accuracy is 90% all the way up to 97%. In my facility, that is where we are at, 97%. So they take a lot of different things into consideration when they're calculating why we should be this high. But the higher the accuracy rate, the more you're going to have to pay attention to those details. And working with your providers is really big when it comes to that. So that is the ins and outs of working in the outpatient setting. You will have to learn as time goes on that there are updates all the time. Every year we go through updates, whether it is coding updates, like different codes. Some codes are deleted, some codes are added, diagnosis, and for procedures as well. So that is something that we all deal with. Sometimes there's not a lot of changes, and then other years they just add like a bunch of different diagnosis codes, more specific diagnosis codes. But that's what makes it fun, and that's what makes it exciting every year, that it gets better and better. And yes, we did go through a huge change in the outpatient setting years ago. We are headed for another change here pretty soon. But for the time being, we're just going to enjoy working with ICD-10. So that is pretty much what I have to say about the outpatient side. And I know I kind of went off a little bit about talking about providers, but when you work in the outpatient side, again, it's really important. Whether you're working in the ER coders, like ER doctors, are very special too, because ER coders have to know a lot about everything. Think about all the things that come into the ER. You want to talk about a perfect coding boot camp. That is going to get you the widest variety of different things that could happen. Injuries, strokes, heart attacks, you name it, they got it. And it keeps things interesting. The ER is, again, a very unique setting, and it takes unique people to work in it. And that includes the coders, so, at least that's my opinion on it. But yes, my final thoughts and my final word on this, when you're in the outpatient setting and you're in a specialty clinic, make sure that you study that specialty, so that way it'll make you sharper. You'll know what to look for. You'll know if there's something that is missing, because if you don't know or understand the anatomy, it's a problem. If you don't know or understand the disease process for that specialty, again, it's a problem, because you could potentially be selecting the wrong procedure or the wrong diagnosis codes. So you always have to watch out for those things. But I like the outpatient setting. It's been my coding home for all of my career. I'm excited to do different things though, so we shall see. But I'm going to go ahead and wrap this one up because I am about out of time. So if you haven't already, I hope you'll hit that like button, please, and hit the subscribe button if you haven't already. And I will see y'all on the next video. Bye!